just quickly introduce myself. My name is Tom Waters. I'm an associate director here at the Institute for Fiscal Studies, where we do economics research on public policy topics, and my research work is centered around labour markets, and I've done some work looking at the impact of long COVID on the labour market, which is of course what we're going to be thinking about today. Let's turn to the first results on the labour market. So the core labour market outcome, of course, is employment. And starting with more severe forms of long COVID, if we look at groups who get more severe kinds of long COVID, it looks to have a really very substantial impact on employment. So, for example, one study examines those who got long COVID and are a part of the long COVID support groups on social media. You might expect that people who get that are more likely to have more severe forms. 22% of them report not working due to their illness. Similarly, if we look at those who are referred to specialist clinics, again, that's more likely to be those that get more severe forms of long COVID, 17% no longer in employment. So these are very significant numbers. But even if we zoom out a bit and look at those who get any kind of long COVID, just defined as having symptoms lasting at least 4 weeks, we still find meaningful impacts on the population. Now here, the exact number you get varies depending on what study you look at and exactly what kind of measure of employment you're looking at. But numbers like 1, 1.5, 3.7% are the kind of figures we see. And so these are meaningful impacts on the labour market. And it's likely that long COVID has contributed to some of the increase in labour market activity that we've seen since the pandemic in some countries. The UK being a clear example of an area where there's been an increase in labour market activity. Given these studies, it's likely that long COVID is contributing to at least some of that. Now, beyond the impact on employment per se, long COVID might have other effects too. Even if you've still got a job, it might be that getting long COVID affects the number of hours you can work, and you might be off sick, and you might even be differently treated at work. And so we've got some evidence on these issues. So starting with the last one, different treatment. One survey of those with long COVID finds that 23% of patients said that their employer questioned their diagnosis or its impacts, and almost half said that they weren't given the changes to their job that they needed to return to work. If we look at the number of hours people work, again, starting with those that are likely to have more severe forms of long COVID, about half of those referred to specialist long COVID clinics have reduced their working hours following getting long COVID, and about a quarter had seen a reduction in their earnings. These are clearly very, very big numbers. Once again, if we just zoom out a little bit and look at anyone who gets long COVID, we can still find pretty meaningful effects. In the UK, about 10% of workers with long COVID are off sick. And amongst all workers with long COVID, we see a reduction of about 2.5 hours a week in hours worked, and about a 6% fall in monthly earnings. And so again, we see quite meaningful impacts, even when we're just looking at anyone that has some form of long COVID. Now, I've been talking about the impact on the labour market. Of course, getting long COVID, the existence of long COVID can have wider economic outcomes too. And so one of those is financial distress. A survey of workers that got long COVID in the UK found that 50% said that they'd drawn on savings to support themselves, 6% had taken out a loan, and 6% had used food banks. And as I highlighted earlier, there might be impacts on medical expenditure too. In the US, some calculations there suggest that long COVID is likely to result in billions of extra dollars of spending per year in medical expenditure. And one quite nice study in Israel, which compares those that get COVID-19 to those that don't, finds that medical costs are about 8% higher for those that do get COVID-19. And that's not only those that get long COVID, this is any COVID-19 infection. And I think quite strikingly, it takes about 16 months for those that get COVID-19 versus those that don't to see their healthcare costs converge. So we're talking about really quite a significant period of higher healthcare expenditure. So what questions do we still have? What do we not know? And there's potentially quite a few things, but just to highlight a couple. First, how long does long COVID impact last in terms of labour market outcomes? I think that's something where we need more research. And secondly, are there certain kinds of people, certain kinds of jobs that once they get long COVID are more affected. Perhaps certain sorts of jobs might be more difficult to do with long COVID, and so people that get them are more likely to be affected. I'd add as well that there's a question on what employers can do to facilitate the return to work for long COVID patients. But one thing that's really worth keeping in mind here is that all of the results and research I've been showing you today are all really very much contingent. They're not set in stone because it's all dependent upon how well people are able to manage their condition.